Iron is essential. It helps make hemoglobin, the protein in red blood cells that carries oxygen from your lungs to the rest of your body. But like many things in life, too much of a good thing can be dangerous. Under normal conditions, your body carefully regulates how much iron it absorbs from food. If your iron levels are low, your body absorbs more. If your iron levels are good, it slows down. But in people with hemochromatosis, that regulation system breaks down. Their body keeps absorbing iron even when it doesn't need any more. Over time, the excess iron starts to pile up, and not in a good place. It gets stored in major organs like the liver, heart, pancreas, joints, and testicles. That iron buildup becomes toxic. It starts damaging tissues, triggering diseases, and, if left untreated, can lead to serious, life-threatening complications. Let's talk about what this iron overload actually does to your body. First, your liver. It's one of the first organs affected. It can become enlarged, scarred, and eventually develop cirrhosis or even liver cancer. Next up, your heart. Excess iron can cause irregular heart rhythms and eventually lead to congestive heart failure, one of the leading causes of death in people with hemochromatosis. Your pancreas isn't safe either. Iron buildup here can interfere with insulin production, often resulting in diabetes. And then there's the joints. Many people experience joint pain that feels a lot like arthritis. It can be persistent and difficult to treat. Even your skin can change. Some people develop a bronze or reddish tone, especially on the face, a condition so noticeable it used to be called bronze diabetes. The problem is, all of this damage happens slowly, over years, and often without obvious symptoms in the early stages. So, who needs to worry about this? Hemochromatosis is genetic. You have to inherit the gene from both parents to develop the disease. This means your parents could be healthy and never know they're carriers. In fact, about 1 in 10 people carry the gene. But only people who inherit it from both sides will actually develop full-blown iron overload. Men are far more likely to show symptoms, 5 to 10 times more likely than women. That's largely because women naturally lose iron through menstruation and pregnancy, which acts like a built-in iron regulator, at least until menopause. Most symptoms start appearing between the ages of 40 and 60, though some people begin to feel the effects earlier. Here's where it gets tricky. The symptoms of hemochromatosis are subtle, and they often mimic other, more common conditions. You might feel constantly tired or run down. You might have aching joints, especially in your hands or knees. Some people experience stomach pain, irregular heartbeat, or loss of sex drive. Others might notice yellowing of the skin or eyes, or a gradual darkening of the skin. The problem is, these symptoms are so general that they often get misdiagnosed as arthritis, hepatitis, chronic fatigue syndrome, or even just getting older. That's why hemochromatosis is often missed until serious damage has already occurred. The good news? It's easy to test for. If a doctor suspects iron overload, they'll start with a simple blood test. 2 things they're looking at are serum ferritin, which tells how much iron your body is storing transferrin saturation, which shows how much iron is circulating in your blood. If those levels are high, they may recommend a liver biopsy, where a small sample of liver tissue is taken and examined under a microscope to see how much iron has accumulated. And as awareness grows, more doctors are including iron screening in routine checkups, especially if there's a family history of hemochromatosis. If you're experiencing unexplained symptoms, or if this condition runs in your family, don't hesitate to ask for the test. Early diagnosis can prevent years of damage. Now let's talk treatment. This might surprise you. The main treatment for iron overload is something called phlebotomy, which is just a fancy word for drawing blood. Yes, really, removing blood is the best way to treat this condition. Here's how it works. Iron is stored in your red blood cells. So by removing blood, your body has to use up some of that stored iron to make new red cells. Over time, this process lowers the iron levels in your body. Typically, doctors remove about half a liter of blood once or twice a week until your iron levels normalize. This phase can take weeks to months or even longer, depending on how much iron has built up. Once your iron levels are stable, you'll only need occasional maintenance treatments, maybe every few months. If you're otherwise healthy, this blood can even be donated to help others, and it's effective. Phlebotomy can reverse heart damage, shrink the liver, and normalize blood sugar levels in many cases. In severe or complicated cases, especially where the heart is already involved, doctors may prescribe chelation therapy. This involves drugs like dysferrioxamine, which help bind to iron and flush it out of the body through urine. Alongside medical treatment, your diet plays a crucial role. People with hemochromatosis should avoid iron-rich foods like red meat, organ meats like liver iron-fortified cereals and breads, egg yolks, shellfish, which can also carry a dangerous bacteria for iron overload patients. You also want to stay away from vitamin C supplements. While vitamin C is healthy, it boosts iron absorption, which is the last thing you want in this situation. Even cooking in cast iron pans can be a problem, since small amounts of iron can leach into your food. Reading labels becomes a must. Many processed foods and supplements include added iron, especially multivitamins. If you're taking any kind of supplement, check with your doctor first. If this sounds overwhelming, don't worry. A clinical dietitian or nutritionist can help you design a meal plan that keeps your iron levels in check without compromising nutrition. Not all cases of iron overload are genetic. Some people develop high iron levels due to secondary causes, such as frequent blood transfusions, especially common in people with conditions like sickle cell disease or thalassemia liver disease, including hepatitis or fatty liver, excessive use of iron supplements, or even cooking all meals in iron pots. So even if you don't have the hemochromatosis gene, it's possible to develop dangerous iron levels through lifestyle or medical treatment. That's why it's important to check iron levels periodically, especially if you have another chronic illness or are receiving transfusions. Here's the bottom line. Hemochromatosis is manageable, especially if caught early. With regular treatment, healthy lifestyle changes, and a little vigilance, most people with this condition go on to live full, active lives. The key is early detection. If you know hemochromatosis runs in your family, consider getting a genetic test. Even if you don't have symptoms yet, catching it early gives you a massive head start. Phlebotomy is simple. Diet changes are manageable, and with the right plan in place, you can protect your organs, avoid complications, and feel better than you have in years. Let's recap. Hemochromatosis is a genetic condition that causes your body to absorb and store too much iron. It can affect your liver, heart, pancreas, joints, and skin. Symptoms are often subtle and slow to appear. Diagnosis is easy, just a couple of blood tests. Treatment is simple, regular blood removal and dietary changes. And with early action, you can prevent serious damage and live a normal life. If you're dealing with strange symptoms that doctors can't explain, or if iron overload runs in your family, it's worth getting tested. It's one of those conditions that hides in plain sight until it doesn't. So stay informed, stay curious, and stay healthy. Thanks for watching. If you found this helpful, share it with someone you care about, and consider subscribing for more health deep dives like this one.